Hey, what's up, guys? I know it's been a week since we've uploaded here on Sync 2020, but I was on vacation, and so was the producer of the film Court, and Dr. Koshar, that is, and now we're back. So thank you so much. We've still had people share the movie and watch the movie and join us here on YouTube. We have over 1,000 subscribers now, which is super cool. We're so excited about that. And we're going to keep rolling out content for you guys because we want to get to monetization. And we want to see if we can stay monetized while producing quality content for you guys in regards to retroactive perspectives. You know, after things kind of roll through, kind of look back on them and see what decisions were made and whether or not those were good. So I want to start with this couple of studies. One's out of France and one is out of the States here. With Dr. Zelenko, and we're just going to go over them a little bit and read through. The first one is in Science Direct. It was originally published in Travel Medicine and Infectious Disease back in July of last year. So one of the things I want to point out is that this has been a trend with certain studies since early last year. This is July, of course, so it's not considered early last year, but early in the pandemic in regards to, you know, the fact that many places started shutting down in February, March, April, and by July, there was already data coming out. This one is in Marseille, France, and it's an early and massive screening for coronavirus disease in 2019. This is looking at hospitalizations and early treatments with hydroxychloroquine and azithromycin. Now, one of the hard things that we're going to address in a future video is that, you know, we talk a lot about hydroxychloroquine specifically, but that's not the only early treatment that was available and that was being tried. There were other things that were being tried, and there's things that are being tried now. We're going to be focusing on this because it was one of the early ones that was showing some positive outcomes. Now, if you were to go to any of the major news outlets, if you're going to go to even the NIH website, you're going to see that there's no recommendations for early treatment. And if there are, they're recent. And so, and there's no mention of hydroxychloroquine and azithromycin. So it's important to understand like that this has been around for a long time and that there was a debate going on within the science community and that one side of the debate was promoted and one side of the debate was totally squashed. Even recently, I was speaking to a doctor friend of mine who mentioned that there's hundreds of studies showing that hydroxychloroquine doesn't work, and so that's why they're not, going to be using it. And the reality is there's also many studies that say it does, right? And so you have to look at why. You have to look into those studies and get more detail. Anyway, so to give an example, today I'm just going to give two examples of studies that say it does work, and both are retroactive studies. They're going to look at things that had done in the past. So under methods, it says, we retroactively reported the clinical management of 3,737 screened patients, including 3,119, 83.5%, treated with hydroxychloroquine and azithromycin. Okay, so this is that regimen that Dr. Zelenko talked about. That's in the movie. Now they did 3 times daily for 10 days, and that was carried out for at least 3 days, right? And so it says the standard treatment given to people was 200 milligrams of oral hydroxychloroquine 3 times daily for 10 days, and then 500 milligrams of oral azithromycin on day 1, followed by 250 milligrams daily for the next 4 days, respectively, right? But then obviously it says right here it says for at least 3 days, right? So they're looking at people who took it for at least 3 days, and then 618, which is 16.5% of patients treated with other regimen, right? So they're going to be referred to as others. Now outcomes were deaths, transfer to the intensive care units, or days of hospitalization and viral shedding. Okay, that's what they're looking at. Right, okay, so results. The patient's mean age was 45. All right. 45% were male. The case fatality rate was 0.9. Now, that 0.9, the case fatality rate, that's much lower than what was originally suggested. Let's look at a case fatality rate of influenza 2018. All right. Okay, so let's see if we can find an actual case fatality rate of influenza in 2018. That's going to be a tough one. They're probably not going to want us to know what it is. Estimated influenza disease burden by age group, United States, 27. Okay. So, 44,800,629 total cases of influenza that are estimated between 2017 and 2018, and 61,000. So let's get a calculator. 4,802,629. So keep in mind, 0.9% is much, much higher than influenza. Influenza, we're looking at 0.001%, okay? Which I've heard that before. Now that I'm reading that, I've heard that before. So keep in mind, that's still pretty high. But initial estimates that we were told back when we did the 2 weeks to slow the spread, which is a year ago this week, or last week, was 4%. So we're already looking at under 1/4 of what they said. So it looks like they did scans. They looked at clinical factors, biological factors, moderate and severe lesions detected in low-dose CT scans were associated with poor clinical outcomes. So that's an important thing to keep in mind. Treatment of hydroxychloroquine and azithromycin was associated with a decreased risk of transfer to ICU or death. Okay? Decreased risk of hospitalizations. A shorter duration for viral spreading. That's a big deal because that affects spreadability. And then they looked at QTC prolongation. Now, this was mentioned in the film, and we really should make a video in more detail about this. Maybe we'll reach out to Dr. Lee Merritt, who was in the film, who talked a little bit about this. A QTC prolongation is a lengthening of the, electrical impulse that tells your heart to beat, right? So now I can't go into too much. I'm supposed to be interviewing doctors about this, but just to get a rudimentary understanding of how that works is it can cause some serious heart issues. But they observed it in 25 patients, which was 0.67%, leading to a cessation of treatment in 12 cases, including 3 cases with QTC of 500 milliseconds. Okay, no cases of sudden death were observed. What we're seeing here is that they had a decent sized group of people looked at. They looked at their other factors that may be affecting things, lesions, biological factors, things like that. And then they looked at the risks, the QTC prolongation, and how many people were affected by that, which was the big issue that people talked about. One of the big issues of hydroxychloroquine being super dangerous. In the conclusion, it says, although this is a retroactive analysis, results suggest that early diagnosis, early isolation, and early treatment of COVID-19 patients with at least 3 days of hydroxychloroquine and azithromycin lead to a significantly better clinical outcome and a faster viral load reduction than other treatments. So is it the only option? No, it's not the only option. Can we look at other things, and should we look at other things? Absolutely. We should be asking questions because that's science. But this is one study that was way, way back, published in July and August of 2020. So now let's look at Dr. Zelenko. What he did is they looked at early risk stratification treatment with zinc plus low doses of hydroxychloroquine and azithromycin, a retroactive case series study. Okay, so let's read a little bit in this second study. Okay, so this second study was done as a retroactive study by Dr. Zelenko, and it was published in the journal, the International Journal of Antimicrobial Agents. And basically, the highlights, it says, first COVID-19 outpatient study based on risk stratification and early antiviral treatment at the beginning of the disease. Low-dose hydroxychloroquine combined with zinc and azithromycin was an effective therapeutic approach against COVID-19. Significantly reduced hospitalization rates in the treatment group and reduced mortality rates in the treatment group. Okay, this was published December of 2020. So it's like we have months and months and months of data at this point, you know? And so all those months of data we have to look at, we have to take seriously, right? So let's take it seriously. Let's look at it. So in the introduction, it talks about the, acute respiratory syndrome, coronavirus 2, which is COVID-19, started in Wuhan, China. The coronavirus was spread rapidly as a pandemic around the world. Kind of gives a little background on it, of course. In methods, let's talk a little bit about this. This is a retroactive case series study. And he analyzed two sets of data. One, he talks about how they were confirmed diagnosed cases. They talked about how they were confirmed, what tests were used. Then he talks about what kind of patients they were. Now, there was three groups. Group A was anyone greater than 60 years old, right? So that's high risk, considered to be high risk. Group B is anyone less than or equal to 60 years old, but had shortness of breath, SOB, right? Group C was less than or equal to 60 years old, but had some kind of pre-existing condition and was clinically symptomatic, right? You could see symptoms. Now, let's look at some of these comorbidities because they're really important. And if you know anybody and have the opportunity to help anybody who comes down with coronavirus, knowing these comorbidities is important because they're at high risk, and we need to take care of that. This is serious disease, and so we need to take it seriously, right? So we're looking at hypertension, hyperlipidemia, diabetes, obesity, cardiovascular disease, heart failure, history of stroke, history of deep vein thrombosis, right? Asthma, pulmonary embolisms, chronic obstructive pulmonary disease, lung disease, kidney disease, liver disease, autoimmune disease, and a history of cancer. Pregnant women, if any, were also included in this group, okay? So we're looking at this group C is really kind of a good thing to look at for the layperson because you can kind of go, who do I know? Who do I know who deals with some of these issues, right? Because these issues reflect somebody at high risk, okay? And we need to make sure that we focus on these people, right? We need to give them the love and attention that they deserve, as opposed to, a rambunctious 12-year-old boy who is very healthy and has no comorbidities, and the likelihood of that young boy becoming severely ill is extremely small, right? Doesn't mean they won't have a hard time with this disease. It just means that statistically speaking, it's very, very unlikely that they will. And so we need to focus on these people, the people who are over 60, who are under 60 and are already having this shortness of breath, or people who are at or under 60 and have one of these many comorbidities. Okay, so that's the people that they were looking at. So, and laboratory confirmed COVID-19 patients from the same community who were not treated with the described triple therapy, their related outcomes data represent an untreated control group and compromise of both low risk and high risk patients. And this was public data. That's where they got this, public data. Okay. So procedures and treatments, let's talk a little bit about that. They said they looked at high-risk patients with clinical symptoms like we already discussed. They looked at what clinical signs there were, their oxygen saturations, the shortness of breath, the breathing rate, their body temperature. They looked at all that kind of stuff to get both a clinical and a diagnostic test, right? So They're diagnosing these people in a detailed way. So they would do the risk stratification requirements of group A, B, or C, those 3 groups we talked about previously. And patients were not treated with hydroxychloroquine if they had known contradictions, including QT prolongation. So that's an important thing. Anytime you go to the doctor and they're going to prescribe you something, they always ask you, are you allergic to anything? That's one of the ways that they kind of say, we need to make sure that what treatment we're giving them is good for this person, right? And so one of the concerns that was brought up in the movie a little bit, and we should make a video here on the YouTube channel to go into more detail on this, is that QT prolongation is going to be an issue, right? A major issue. People are going to be dropping dead from heart attacks. They account for that in treatment, okay? And so we'll talk about that a little bit later in outcomes. Okay, so let's look at outcomes. 2 outcomes were studied. COVID-19 related hospitalization administrations and all-cause death during the time of follow-up of greater than or equal to 28 days of treatment in the treatment group, and in the untreated group with public references. The outcome of COVID-19 patients in the untreated control group was reported by responsible health departments. Okay, in the discussion, the first paragraph, it says, the first retroactive case series study of COVID-19 outpatients in a primary care setting showed that risk stratified treatment early after onset of clinical symptoms with triple therapy of zinc, low doses of hydroxychloroquine, and azithromycin was associated with significantly fewer hospitalizations. Let's look at hospitalization rate, okay? In the treated group, 4 of the 141 patients were hospitalized, which is significantly fewer than the 58 of the 377 patients who were untreated with the triple therapy. Therefore, the odds of hospitalization of treated patients was 84% less than the untreated patients. That's a big deal. 75% of the 4 hospitalized patients belonged to risk stratified group B, and 25% of the group, were in risk stratification group A. That's a huge discrepancy. Look at this. I mean, it's... Okay, let's keep going. From onset symptoms to first medical consultation was 4 days. Okay? That's so important. I've talked to a bunch of people, starting with my parents, all the way down to friends, relatives, friends of friends, and asked, when they got diagnosed, when they took a PCR test and got the results, or they got that quick 15-minute test, they're either one of 2 things in regards to outpatient. Go home, rest. If you get shortness of breath, go to the hospital. Or, here's a Z-Pack. Go home, rest. If you get shortness of breath, go to the hospital. That's all that was being done, and that's all that's being recommended. We looked recently on the NIH website, and it's still looking like there's little to no suggestions on early outpatient treatment. And so we have to keep in mind that there are options, but they're just not telling us that there are these options. And there's all these studies that they're telling doctors at hospitals that show it doesn't work, and they're saying, see, it doesn't work. And then that's the end of it. And so we need to go out and share these kinds of studies where the data is there to support what we're saying. It's all hearsay until we show data, and that's really important. And so I'm going to take this and I'm going to put it in the description below, give you a chance to read through it. If you notice things that I didn't notice, put it in the comments. If you have concerns, put it in the comments. Because these are concerns that we can reach out to experts, ask them, see if we can get them on. This is all part of learning. It's all part of moving forward as educated people through freedom of speech, through speaking to one another. Now, we are not yet monetized on this YouTube channel. We'd love to be, which means we need to create more content for you to enjoy, because we need to hit a certain amount of hours watched before we can monetize. Once we do that, we want to post more of the film here, okay? And we want to see if YouTube censors us. That's really what we want to see. We want to see what data-driven information, like I'm doing here, before YouTube censors us. So please like and subscribe, share with your friends. Let's get this channel going so that we can really share with other people what we're finding. And I'm working on getting experts on, more doctors. I've spoken to some of the doctors that were in the movie. They're going to come on and join us here on the YouTube channel to share more information. We're so grateful for you guys watching and sharing the movie. Keep it up. Stay safe, stay healthy, and we'll talk to you later.